Hi friends, this is Dr. Priya Ishpunyani from Asian Cancer Institute, Kambala Hill Hospital. November being Lung Cancer Awareness Month, I just wanted to give a short information which is quite surprising and we actually are not very happy with it. A lot of patients have come to us in the last 2 months who have had COVID in the last 2 to 3 months, and when they were investigated for COVID, that is a HRCT scan was done, they were discovered to have incidental lung cancers. So in a way it was lucky that they got it done, they got it checked, and so COVID was probably a I would say blessing in disguise for them. So we've operated at least 4 patients in last 6 weeks who had this finding. This highlights us to the fact that the India strongly needs a lung cancer screening program, which is not very easy to get established because of the cost factors and the population reasons. But we would still want to advise to the patients that if you're above 50, 55, if you've been a smoker, or if you have quit in the last 15 years or so, if you have any vague chest symptoms also, it is advisable to get a low dose CT scan chest of yourself done at least once a year. It sounds very loud and it sounds very unreasonable, but the fact remains that low dose CT scan, is less costly and it has caused less radiation. That is a very important method which has also been advised by WHO for early diagnosis of lung cancer. These 4 to 5 patients were lucky because they got COVID, but we wouldn't want COVID to stay forever, but we want our lung cancer incidence to go down, one, and second, that we are able to diagnose and treat lung cancer early. So on this Lung Cancer Awareness Month, I would really like to highlight that please be aware that it exists in the world. Lung cancer very much exists, and if treated, if diagnosed early, it has very good treatment and cure rates. So let's forget about क्या हो सकता है हमारे साथ क्या नहीं. If you get it, let's get to target it as soon as possible. So all the best. Keep in mind for all the practitioners, for all the laymen, that keep this awareness and suspicion in mind that yes, it does exist, so that we can together fight it and beat it. All the best.